Today we're talking about three very important things related to your lower back and hip pain. One, why it might be the hip capsule, not muscles, that are the root of all your problems. Number two, how our motto Wilhelm will help us see, learn, and understand the difference between the capsule and the hip muscles. And number three, why you need to rip that tape off the baby's mouth, get off the couch, set the crack away, put the cheese sandwich down, learn how to touch and play with yourself to truly know, understand, and feel the why behind your pain, or nothing's gonna change. If you're on Instagram, rotate that phone 90 degrees and let's get going. So what we need to understand is every single joint has muscles around it, but it also has a capsule. And the capsule, which would be in the hip's case, this thing that's wrapping my hip into the hip bone, for lack of scientific terms, is more of a fascial, cartilaginous, tight material. Yeah, I really want to try to keep it as unscientific as possible. But point being is when it gets tight, it's very hard for it to regain its range of motion. So it's going to take some time. And if all of the muscles in this area are super flexible and the mobility is fantastic, but the capsule is tight, that will bring us nowhere, which here in a few seconds, I'm going to go over to my buddy Wilhelm and he's going to show us exactly what I mean by that and why. But basically, right here, we have the muscles of the hip. And then if we go one level deeper, now you can see the capsule and you can understand why when the capsule is tight, it doesn't matter how beautiful your range of motion in your hip is, it's not going to be going anywhere. And if we have this cartilage within our hip, and bone is the most sensitive tissue in the body, that capsule is super tight, and we're always moving in this area in which the hip is going against the hip bone, which we're going to see in Wilhelm, what that actually looks like. That is bad news all the way. So what we want to do is begin to open this area up. Now, some of you might get in this position and completely fall back because you're not able to really get that back straight, that butt out, and get that push in your hip. If that is the case, I'm going to show you a little bit of a trick, which actually maybe I can even do here. Basically, what you would want to do is not sit against a treatment table where it's going to hit you in the head, but you would want to sit against like a nice chair or a wall, which this is not doing well at all. And from here, I would be able to get the same thing. Again, it probably should not cut you off the neck. Go ahead and just use a nice little chair or a wall, because now you can't fall back and you can focus on the stretch. You can also kick this leg out a little bit. The problem is once you do this, you might not feel it at all. I would suggest you actually sit against the wall, sit against a chair, have something balance your back, and then go into, let me see if I can kick this bad boy back in, this position. And then most importantly, what we want to do is make sure the microphone doesn't fall off, but also then I'm going to come back to you here because I don't need that support. Check the other side, because you need to always, or never forget, always remember, if I was going to finish my sentence, that the balance or imbalances in the body are what either make us or break us. The last thing we want is a tug of war between Team Navy SEALs and Team Toddlers. So we want to make sure that we are doing both sides. Now, if you have one side that is much worse, should you do it more than the better side? Of course you should, because that is going to help bring the balance back. Now, of course, you can do anything however you want. It's always better than eating a cheese sandwich and smoking crack on the couch. But we want to at least, as I always say, play with ourselves and touch ourselves, because that is how we are going to learn this language that our body is speaking. If the baby cries, you don't put duct tape over its mouth, yeah? But yet every single time we have hip pain or back pain or whatever pain, we pop a pill, we numb the pain, and we continue to do what we're doing. That's not a good idea. So what I want you to do is test both sides, play with your position of the body, rock back and forth, see if you can get your back straight, and see if you feel the area that's stretched in your hip. Now let's go over to my boy Wilhelm and understand exactly what is going on. All right, so Wilhelm is actually using the bathroom right now, so I wanted to take a quick moment and show you what I meant by leaning against a chair. So you can use a wall. I think a chair is a little bit more comfortable, but what this allows you to do is if you're completely broken in this position because your mobility is tight, that's not a problem. This allows you to lean against something, create some torque both against your hip and also your back in order to start getting into a better position. Listen, I live in southern Germany and Berlin is 8 hours away. And every single time I say, is it possible to walk from Stuttgart, where I live, to Berlin? It is, but you have to shut up and start to trip. If you just bitch about it all the time, you're never going to get anywhere. And you never know. Maybe 10 feet later, after starting the process, somebody swings by in a car, picks you up, and drives you all the way there. But you don't know if you don't get started. So if you are in a horrible position, or you can't even get that leg straight, and you need to use the chair and this, that is okay, because I can promise you it's going to bring you a hell of a lot farther than popping pills, masking the pain, going out of your way, having doctors telling you the only thing they can do is cut you open, cut it off, give you a new leg, and that your life is done. Start, listen to your body, play with yourself, feel yourself, understand the language it's trying to speak, and let's move forward. And Wilhelm's back from the bathroom, so let's get over to him now so you can understand exactly what's going on with your capsule of your hip and the muscles of your hip. All right, so I have scooted Wilhelm and I to the side a little bit because I want to again highlight the importance of the musculature, that's always hard to say, of the butt versus the capsule of the butt. And you can imagine if the capsule, as you saw in that picture, hopefully, is much smaller and tighter, and it's also less elastic than the muscle, so to speak, then when this gets tight, as you can notice just from kind of basic like carpentry or physics, that when this area is tight, I'm gonna only have two hands unfortunately, that the leg bone, especially if it's stuck on the wheel, does not want to move, the femur in this case, because this is very tight. So if the butt muscles themselves look beautiful, I'm sure, but also have great range of motion, but the infrastructure, the layer underneath it, the base, again, does not have the elasticity that the muscles do, and it is so crazy tight that it does not allow it to move, then unfortunately all that hard and beautiful work you've done to get that great mobility in the hips is lost, unfortunately, because the less elastic capsule here is preventing all of your hard work from being shown. So what we need to make sure that we understand is why we open up the hips. Again, the muscles are here. We also want to make sure that we are paying attention to the hip capsule, again, which is here, because if we don't, unfortunately, all of the work that we do to open up our hips, again, is better than smoking crack and eating a cheese sandwich on the couch, but it's kind of counterintuitive and it's being lost in translation because the layer underneath is preventing all of your hard work from getting the results that you deserve. All right, so if you like to stretch like this, if you liked Wilhelm's anatomy lesson, understanding the capsule versus the muscle, you enjoy these videos, you like to touch yourself, you want to put the crack away, and you want to learn more about it, look at the link below or wherever it might be. Enjoy my 5-day unbreakable lower back free challenge. It's a very long name. I do 2 a month. They're obviously free. They're 5 days. I go into a lot of really cool information. And this is for people that actually want to make either A, a change, or B, just listen to me talk. So hopefully make a change and learn how you can become and stay pain-free by using your own body, knowledge, and education versus relying on pointless visits, doctors that don't know what they're talking about, and medicines that are only going to destroy your gut and basically be putting duct tape over a baby's mouth. So hopefully you don't want to duct tape babies, and if you don't, then join my challenge and I'll see all of you soon, and also subscribe to the channel if you've not so yet.